He spent 40 years healing the sick, but Genodyne twisted his cure into a ticking time bomb. Dr. Elijah Brooks lost everything, then made Big Pharma pay in blood and billions. Welcome to The Fallout Zone.
I was 6 when my baby cousin collapsed during a sickle cell crisis. Powerless, I promised myself I'd never watch someone suffer like that again. 42 years later, I held the patent for a therapy that could end those crises forever. My lab at Howard buzzed with graduate students, and my inbox overflowed with offers from pharmaceutical giants clamoring to partner. I chose Genodyne Therapeutics because their lead negotiator looked me in the eye and said, "We share your mission." I believed him. Genodyne flew me to their glass fortress in Boston, signed a consulting contract, and plastered the press with photos of the historic collaboration. For 18 months, I watched from the sidelines while their R&D team ran phase 2 trials. The preliminary data looked pristine until the spreadsheet stopped coming. My emails went unanswered. A polite, silencing hush settled over everything. Then Maya, my favorite niece, my shadow in the garden, the reason I never skipped Sunday dinner, volunteered for the open label arm. 2 weeks after her second dose, she seized on her apartment floor. Massive cerebral infarction. 26 years old. The neurologist traced the clotting cascade back to Genodyne's drug. They logged it as under investigation and discharged her with an apology card. I demanded the raw data. Genodyne's legal team mailed a cease and desist instead. That's when I filed whistleblower complaints with the FDA, the NIH, every ethics board I could name. No response. A colleague finally whispered that Genodyne had settled, hush money delivered with airtight NDAs. The realization tasted like battery acid. My life's work had been weaponized for quarterly earnings. Desperation pushed me into the darknet forums where disillusioned scientists trade code and conscience. That's where I met Helix Fire, a biohacker collective who believed knowledge should be free and corporations should bleed when they lie. They offered resources. I offered the smoking gun. From an old backup drive, I still had my original unaltered research files. The baseline Genodyne had twisted. We built a two-pronged attack. First, I scraped Genodyne's secure servers using a forgotten consultant credential. Thousands of files flowed out, manipulated lab results, internal memos coaching employees to downplay hematologic anomalies in African-American cohorts, wire transfers to key reviewers. Second, Helix Fire cloned Genodyne's trial protocol, recruiting volunteer data scientists to run the numbers honestly. In 48 sleepless hours, we produced a damning mirror study showing a 37% rise in cerebrovascular events. Timing was everything. We packaged the evidence into a sleek microsite, Countdown to Cure, and sent an embargoed scoop to investigative journalist Zora Caldwell, whose last expose sent a hedge fund CEO to prison. Friday 6 a.m., Zora's story dropped. By 9 a.m., Genodyne New was the top hashtag on X. Helix Fire's site displayed a live ticker of adverse event reports, while an open-source tool let users simulate Genodyne's hidden data manipulations with a click. Wall Street panicked. Genodyne stock plunged 42% before noon. The FDA issued an emergency hold. By sunset, class action attorneys were circling like vultures. Maya watched the coverage from her rehab bed, squeezed my hand and whispered, "Uncle Eli, you did it." That single tear on her cheek powered me more than any Nobel, but victory came laced with betrayal. Sifting through leaked email threads, I recognized a familiar username, A. Bellamy. Dr. Alicia Bellamy, my protege, my guest at Thanksgiving, had edited the raw genomic datasets months before Genodyne ever contacted me. She'd sold the doctored files for a 6-figure signing bonus. The moment I saw her name, the room tilted. My war against Genodyne had started inside my own lab. The media labeled me a cyber terrorist. Howard revoked my emeritus status. Yet parents flooded my inbox with gratitude, and community clinics invited me to speak. I chose the shadows instead. Once a month, I unlock the basement of a free library, push tables together, and teach a dozen young researchers how to recognize the line they must never cross and what might happen if they're forced to. Do I regret hacking? Manipulating the market? Sometimes. I hear my old ethics lectures echoing in the dark. But then I remember Maya's monitors beeping. Remember Genodyne executives toasting champagne while patients convulsed, and my guilt quiets. Justice isn't always polite. Sometimes it's a scalpel, precise, sharp, and absolutely unforgiving.
Thank you for watching The Fallout Zone. Please don't forget to like and subscribe. See you next time.